Hello, you're listening to coronavirus updates on The Wire. More than 48,000 people have contracted the virus in the last 24 hours. India has been reporting a rapid surge in new infections. For the fifth straight day today, India has recorded more than 45,000 new infections. With this, over 14 lakh people have been affected across the country, over 32,000 people have lost their lives, and 8 lakh people have recovered. New lockdown rules have been implemented in different parts of the country. Till the end of this month, certain districts of Chhattisgarh and Odisha will be under complete lockdown. West Bengal, Sikkim, Nagaland's capital Kohima, Madhya Pradesh's capital city Bhopal, and the Kashmir Valley will also be under lockdown till the end of this month. Governments of at least 3 states, Kerala, West Bengal, and Telangana, have said that there is community transmission in their states, which means they cannot trace the infection from the index source anymore. The Kerala Chief Minister Pinarayi Vijayan told the media that community transmission could be happening, though only in a few coastal areas. Telangana, which has seen rapid rise in the number of cases in recent weeks, also hinted at the same, though the Telangana government was guarded in its statement. In an interview to the Indian Express, the Maharashtra Health Secretary also officially did not deny community transmission in the state. In multiple interviews to The Wire's Karan Thapar, epidemiologists have said that India is indeed in community transmission phase. But ICMR's Balram Bhargav and Niti Aayog's Vinod Paul have categorically denied it, including the Union Health Department. In a recent interview, another epidemiologist from the University of Michigan said that India is in community transmission, and here's why she thinks so.
So I'd really like to know the scientists that are representing and working with the government, how they actually are proving that there is no community transmission. So because I would like to see if there has been a pooled sample survey taking samples from the community and detecting that there is no positivity. And so I believe that cases are happening indeed where people cannot identify any known source. And so I believe that's the definition of community transmission. That's the quintessential definition. And at that point, you lose control of the contact tracing mechanism because you cannot really pinpoint every case. And that's what happens because initially all the cases are initially imported and you can track the cases through a known source of exposure and contact tracing. But when it is so widespread, I do believe that community transmission has happened. I'd also like to know that Kerala and West Bengal and other states which are declaring that there is community transmission, is it based on data or is it based on a pooled sample survey? I think that this infrastructure is very needed before coming up with conclusions in either side.
Yesterday, health authorities in Bangalore said that over 3,338 people who have tested positive for the novel coronavirus, which account for roughly about 7% of the city's total caseload, are quote unquote untraceable. According to the municipal body in the city, this could be because many COVID 19 patients disappeared after testing positive, and some provided incorrect phone numbers and addresses, making it difficult for the police to find them. Sadhvi Pragya, who is an MP from Bhopal, appealed to people to recite the Hanuman Chalisa 5 times a day till the 5th of August. According to her, this will rid the world of the coronavirus pandemic. Bhumi Pujan, or the groundbreaking ceremony for the construction of Ram Temple at Ayodhya, is going to take place on the 5th of August. Sadhvi Pragya in a tweet said, "Let all of us together make a spiritual effort to wish people good health and end the coronavirus epidemic. Recite Hanuman Chalisa 5 times a day at your home from July 25th to August 5." She also added that people must conclude this ritual by lighting lamps on the 5th of August and offering Aarti to Lord Ram at home. Sadhvi Pragya in the past has been quite vocal about the construction of Ram Temple at the Ayodhya site. Few days ago, Minister of State Arjun Ram Meghwal was also seen endorsing a brand of papad and saying that it had ingredients that will boost a person's immunity and help defeat the novel coronavirus. The video is undated and it caused a storm on social media. Twitterati were laughing at it, and the scientific community questioned the claims of the minister, calling him irrational. In the video, the minister also says that ingredients of this particular brand called Bhabiji Papad helps quote unquote develop antibodies to fight the virus. In addition to this, Meghwal was also seen wishing the brand's owner, Sunil Bhansali, on the launch of the product and saying that he hopes the venture will be successful under the Atmanirbhar Bharat initiative launched by the central government. Earlier this month, Oxford AstraZeneca jointly released the results of its early trials. The results showed positive signs, and after this, the Serum Institute of India, which has partnered with AstraZeneca to manufacture the vaccine, has sought permission from the DCGI for phase 2 and 3 clinical trials of that vaccine in India. According to media reports, an application seeking permission for conducting trials of the Oxford vaccine, branded as COVID Shield, has been sent to the DCGI. Serum Institute has also said that around 1,600 participants of more than 18 years would be enrolled in the study that will be done in India. The trials of India's indigenous COVID 19 vaccine candidate is ongoing at 12 sites selected by the ICMR. Reportedly, the Postgraduate Institute of Medical Sciences in Rohtak or PGI Rohtak has claimed encouraging results from the first part of its early tests. Earlier this week, AIMS in Delhi administered the first dose of the vaccine to a 30-year-old man. According to Clinical Trials Registry of India, Covaxin phase 1 and 2 trials are expected to take 1 year and 3 months to complete. This is just the first part of the phase 1 trials of the vaccine, which is currently undergoing in around 375 volunteers. According to data released by Johns Hopkins, IMF, and Bloomberg, Latin America now accounts for 7 of the world's 10 deadliest COVID 19 hotspots. Data published in Bloomberg.com shows that Chile reported 80 deaths per 1 million people in the last 7 days, and Peru added 154 fatalities per million to its tally. This is higher than anywhere else in the world. In addition to this, Panama has the third highest rate, followed by Bolivia, Brazil, and Mexico. Chief Latin American economist at Goldman Sachs Group in New York, Alberto Ramos, said that what's striking the most is that despite low testing, the numbers in Latin America are ugly. In Orissa, a 101-year-old woman has recovered from COVID 19 and was discharged from the Sri Venkateswar Institute of Medical Sciences in Tirupati. Speaking to the IndianExpress.com, Hospital Superintendent Dr. R. Ram said that Mangamma was mildly symptomatic and complained of cough at the time of admission on the 14th of July, and that all her family members have tested negative for the viral infection. Though Mangamma is frail and wheelchair bound, she does not have any comorbidities. Asked about her mental condition, doctors at the hospital said that she herself directed the ambulance driver to her house in Tirupati and is perfectly all right. That's all for today. Thank you so much for tuning in. Keep reading and watching The Wire and The Wire Signs. We will see you tomorrow. Until then, stay safe.